Good morning, everyone, and welcome to Frank Talks. I'm Mindy Tate, Executive Director for Franklin Tomorrow. And if any of my friends out there want to go and let us know if we are live on Facebook, I think we are. And so welcome to Frank Talks. It's Monday, May 10th. And Patrick Baggett, our board president, is with us. So Patrick, unmute yourself and tell us about this morning.
Good morning. Yes, we're excited to have this wonderful panelist of presenters today on Frank Talks, and specifically want to thank our sponsors. All of our events at Franklin Tomorrow are free of charge to the public, and our Breakfast for the Mayors and our Frank Talks, and we couldn't do that without our partners. And so today we want to thank Nicole Volk from Williamson Medical Center, and as well as Diane LeBlanc from Renasant Bank. Couldn't do it without you both. Nicole, would you like to share first, and then we'll pass it to Diane? How are things going at Williamson Medical?
Great. Can everybody hear me okay? Great. We are so, as usual, happy to be partnering with Franklin Tomorrow and the Frank Talks, especially with today's topic on mental health. Over the past year plus, we all have dealt with that in our own way at some point, and it's more important than ever to be aware of the importance of it. And so I really look forward to learning more about coping tools and just increasing all of our education and awareness on it. So I thank you for bringing this to us.
Excellent. Diane, how are you this morning? We love your new art view this morning. Looks so fresh and springy.
Thanks so much for having me this morning. And I am in a little different setting. Thought we could use a little bright colors since we don't have any sun outside. I thought I'd bring some inside. And just wanted to say thanks for allowing Renasant Bank to partner with Franklin Tomorrow and Frank Talks. It's always so spot on with our topics and what's going on around us. We also are celebrating Small Business Month in May for our small businesses. So we've got a lot going on and really trying to continue to help small businesses in our community, as we know that they really need things to come back. So we've got a couple of events, some webinars that if you missed the live versions, you can always go back and view it. But we had one last Thursday that was focusing on finances for small business owners. And then we also have a series that we started last year with women and female-owned businesses that was called The Nest. And we're going to be starting that up as well to just help female and small business owners, educate them on just an overall financial well-being. So I wanted to mention that too. You'll find all of that on our website, renasantbank.com. So look forward to helping and look forward to the program today. So thank you.
Thanks, Diane. Thanks, Nicole. Nicole, I'll come back to you just briefly. Our topic today is mental health, and I'd love to just reflect with you briefly on how Williamson Medical Center is involved when there is a mental health crisis or mental health call in our community.
Yes, many of times, as you know, we are the 911 emergency provider. So a lot of times our EMS providers go there. We also help a lot of people in our emergency room with mental health and trying to get them the resources they need, to help continue their care. Have a lot of partnerships in the community. It takes everyone, and we partner with everyone here. And just so glad to have those resources in our community, so that way we can really help people, especially, like I said, over the past year, we have seen a significant increase, and with just the isolation and everything with the stress going on in our world today. So that's partnership is the key, and the community is the key to helping all those that need it. And all of us have been there at some point this year, I think. So.
Well, we certainly appreciate both you and Diane, and we know you have busy days if you want to stay on or if you want to need to leave. We know you've got things to do, but Patrick, you and I've got one more week of our Civic Index initiative, and we are excited to be bringing that sort of together and to a close. But the Civic Index has been great for us, and it's really about measuring the things that make our community so special and make us an all-America city, right?
That's right. Yes, it has been. It's been a great process. And we really want to now push and get folks to share the link to take the self-assessment and learn more about the self-assessment on our website. And the link to take the self-assessment is on our website as well. And we really just want to get as many people to take that self-assessment of our civic capital here in Franklin as possible. And it's the twofold. It helps us as an organization form various initiatives in the future, helps the city understand perceptions of civic capital. Yeah, it's a great process, and hopefully everyone here listening on Frank Talks will take the time. It takes about, I don't know, 5 to 7 minutes to complete online. It's very easy, and look forward to seeing those results when they come back in.
It is very easy to participate in that, and we have, I'm putting the survey link in there. We have one more virtual session set up for this Wednesday at 2 p.m. And you can go to our website and find information on how you can participate in that virtual session if you want, but you don't have to participate in a survey, in a conversation to take the survey to measure our civic capital in our community, which is about 7 components: about engaged residents, collaborative institutions, inclusive leadership, embracing diversity and equity, and several other topics. And Mayor Moore, you've been generous with your time and have attended several of those sessions. And each conversation's been different, right?
Absolutely. Each one has been interesting. And I think it's such a great opportunity to work with Franklin tomorrow and identify how our community views our strengths, also our weaknesses, and gives us that opportunity to focus in on those areas we need to improve in. And so we're not perfect, but we want to be.
We do want to be, and this will help us strive to improve in some of those areas for sure. And so we're excited to have that process in place for this week. And the survey will be open through the end of the month of May, but we would encourage people to get that done, to reflect on your conversations, and then possibly participate in the remaining virtual session on May 12th. So we're going to move into our topic now, and I'm going to share the screen just for a minute. And again, try not to jump around too terribly much, but have that available for people to see. So our topic today is, and it doesn't want to share because I will just go from there. Our topic today is mental health. And this has been a topic, I'm going to start with you, Mayor, and then come to Cathy, and then we'll bring in Cathy Montgomery, our Williamson County Health Department Director. And Cathy, mental health's been a topic that you've been focused on for several years as part of the community health plan. And we'll come back to you in a minute and talk about that. And then we have also with us James Miller, who's the CEO of Rolling Hills Hospital. And it's kind of something that maybe people don't know enough about in our community, a resource, but we're going to talk about resources and the need that exists. And so I guess it would be better to initially talk about need and how that became more identified in our community, Mayor Moore, through some work that you and Chief Faulkner did.
Well, thank you, Mindy and Patrick. It's good to see you this morning, and love these Frank Talks, and thanks for the opportunity to be on. This happens to be Mental Health Awareness Month, and but the focus of what we've been working on for over a year now has been to raise awareness in our community about mental health. We talk a lot about being fat and not getting enough exercise, and we shouldn't do certain things. But one thing that's been kind of a difficult topic for many in our community to talk about has been mental health issues. And that's where Find Hope Franklin has been working, is to, number one, elevate that conversation for people to understand that it's okay to talk about it. It's just, we talk about being a diabetic. It's okay to talk about people that have anxiety, depression, so on and so forth. You mentioned Chief Faulkner. She and I have had a concern about suicide in our community for some time, and that was one of the influencers as far as moving forward with this Find Hope Franklin. We're focused right now on making sure that our community knows where the best resources are if there is a mental health crisis. And so we've created a website, and we've worked very closely with people on our Blue Ribbon panel to identify what the best resources are and then put those in our website. The major focus most recently has been on training trainers in question, persuade, refer, or QPR. And so we have 11 trainers trained now, and we're looking forward in July to move forward to training smaller groups in our community on Gatekeeper, QPR. We don't have enough mental health professionals in our community. We have long lines waiting in many of the resources for counseling, such as Mercy and such as Refuge Center. I want to give a shout out to Cathy. Cathy's done such a fabulous job during the pandemic, and she's been such a great participant in Find Hope Franklin. We certainly appreciate that. And a real shout out to James. James is with Rolling Hills, and he's been very instrumental in bringing great ideas to us to consider and making additional resources available. And so we certainly appreciate that. I'm glad Nicole was on there and mentioned the 911, that they're the source of 911 for mental health, because that is one place that people go sometimes to the emergency room and spend several days, or they may end up in jail. And so we're working with James to identify additional resources, which I hope he'll be able to talk about, where people can get into a continuum of care for whatever issue it may be. And so I really appreciate being part of this. I appreciate your raising awareness of this in our community, and look forward to some questions.
Thank you, Mayor. So tell us a little bit more. I've been involved in Find Hope Franklin, and Franklin Tomorrow has been involved in that. Tell me a little bit about who is involved in this. It's really a blend of professionals working in the mental health field, but also interested individuals and affiliated organizations, right?
Well, I appreciate you bringing that up. And this is probably one of the most outstanding groups that I've worked with as far as energy and interest. We have counselors from Williamson County Schools, Special School District. We have the clergy represented, faith community. We have various mental health professionals. We have Cathy Montgomery, who represents the health department, and James is part of this group. And we also just have a few citizens that are interested in this. Certainly Franklin Tomorrow has been a driving force and a big help for this. And then we also have had some volunteers from the public relations side. Mike Allday is very helpful, and he's taken this on as some of his work, and helped us make connections to continue to get the message out about mental health awareness, and also create these resources.
So you mentioned QPR, and Cathy will talk about this a little bit at the end of your presentation, but it really is just about questioning, persuading, and referring, but people need to be able to participate in a positive way, right?
Well, I like to compare this to CPR. Everybody's quick to learn CPR. QPR can save just as many lives as CPR. So that's why it's so important for people to understand. They don't have to understand how to push on somebody's sternum and compress the heart so many times per minute. This is something that they use their brain and ask questions and understand what the resources are out there and how to direct people to the proper place. And so I look forward to interest in our community from small groups. I think up to about 25 people we can train in one session, and it's lasts somewhere between an hour and a half. So I hope that we'll see civic groups interested. I hope we'll see Sunday school classes, church groups, bridge clubs, whoever, that they'll come forward and have an interest in doing this.
Well, thank you, Mayor, and we'll come back to you. I'm going to go to Cathy Montgomery. Cathy, you and I have worked together on the Williamson County Health Council for a number of years through our Get Fit Franklin initiative and other opportunities. But really, mental health has been identified in our community. Tell me a little bit, first tell us a little bit about the community health needs assessment and how that occurs and the role the Health Council plays in that while I pull up your slides, okay?
Absolutely. Thanks, Mindy. And I appreciate the opportunity to be here. So every 5 years, the health department actually partners with Vanderbilt University Medical Center to conduct a community health needs assessment in our county. And that includes a lot of data collection, including primary data, which is data that we actually collect through research and surveys or census. And then secondary data, which is your rates, your percentages, your statistics based on, for example, heart disease, suicide rates, that sort of thing. We spent a year just collecting data through this process, and that included doing community listening sessions where we actually pulled focus groups together to ask our residents what they felt were some of the assets in living in Williamson County, as well as some of the opportunities for improvement that we have. We also interviewed key informant stakeholders, for example, school principals and mayors and city officials and so forth, to ask them the same questions. And then, of course, we did a survey that was sent out to over 5,000 people just to collect some information about what they felt like were opportunities for improvement, as well as our key assets, and then asking more pointed questions about, for example, mental health. And like Mayor Moore explained that, you know, one of the findings that we had was that there weren't enough mental health providers. That definitely was a weakness in our community. We held a summit in 2019 and actually went through the data. We had community residents, we had key stakeholders, and went through the data and identified what the community felt were our priorities. We picked about 4 priorities, and suicide prevention was one of those priorities that came out of our needs assessment. And so collectively as a group, we actually developed goals and objectives around suicide prevention. And if you want to go on to the next slide, Mindy, unless you have a question.
Cathy, let me just point out here, and anybody can speak to this, but the data showed that most people were feeling stressed. Most people who participated were feeling stressed, and many had felt what they felt was sad, blue, or depressed over in the past 30 days. Did those numbers surprise you?
A little, because we live in a fairly affluent community and certainly have a lot of resources and access to lots of healthcare in our community. So yeah, I think I was a little surprised. Some of the other panelists might not be as surprised as I was, but certainly when we looked at not only the self-reported data, but also looked at statistics around suicide and some of the data I'm going to share with you here in just a minute, I don't think it wasn't as surprising. So I'll just go on to say that we wanted to look at even more information because as a group, as a health council, which is made up of various agencies and community residents throughout our county, we wanted to make sure that whatever we were creating as far as objectives and strategies and even activities to implement, that we were targeting the right populations. I know there was a lot of discussion when we talked about suicide prevention around working with youth. But then as we pulled more and more data, we identified that youth, while there were some components in the data that showed, threats or, even attempts, that it was mainly among our middle-aged white males that most of our deaths in Williamson County occurred. So we actually reached out to the 911 call center and grabbed some data from them on calls for service, 911 calls for service around threats and attempts, and then pulled other data from our I've just blanked, I'm so sorry. Medical examiners to get the completion data. So when we looked at our information, we saw that we had more males that actually threatened suicide, but then completed suicide. And again, most of those deaths occurred among our males that were 50 to 69 years. And then we looked at attempts, and let me just put a disclaimer here that this 911 communication center data does not include data from Brentwood, their 911 call center. Okay, so this is just from our call center here in Williamson County. And then when we looked at suicide attempts, we saw obviously that more females attempted suicide, not just threatened, than males, even though the highest prevalence of completion were among our males. And about 20% of our suicides, which was also a little surprising to me, among females are from firearms. Those are the completion data that 20% were firearms were used. But then when we looked at our completion data, we broke it down, and this is data that was taken over from 2013 to 2020, even as early as last year. So we average about 32 deaths a year in Williamson County, at least we did last year. And we see the highest prevalence of deaths occurred among our 50 to 59-year-olds and mostly males. The other thing that the information from our medical examiner's office gives us is not only just the completion, but it breaks it down by demographics, how the death occurred, where the death occurred. And again, that helps us to really target our populations as well. I will tell you that from 2013 to 2020, the most, I already said, occurred among 50 to 59-year-olds, with the oldest person committing suicide was 94 and the youngest was 14. You can go to the next one and I'll just finish up on the data part. So the other thing, and thinking about when we're coming up with strategies, really who we want to target our suicide prevention messages. Obviously, when we're creating messaging, like Mayor said, we're working a lot with All Day Communications and different agencies like that to get some information out. So we really wanted to look at who we're targeting on these messages. And one thing that was alarming, I think, to the entire task force was when deaths occur. And so when we look, because most people predict that most suicides will occur during the holiday season, during November and December, but what we found is that most of our deaths, and this is predominantly year after year, occurred in the months of June, July, and October, which was pretty surprising to us. Obviously, we looked at gender and our race. We had no Hispanic deaths in that period of time, which was also quite alarming, seeing as we do have a high Hispanic population in our county. So like Mayor said, how are we addressing the issue? We actually worked with Franklin Tomorrow. We developed a grant and submitted that grant to offer that QPR training that Mayor Moore discussed. And it was really an attempt to look at how we can alert people about the signs and symptoms of those who might be contemplating suicide, so that we could get them into mental health services a little bit faster. He also alerted you that we created the Blue Ribbon. He created that Blue Ribbon Task Force, which has been a great collaboration of our community partners and looking at ways that we can address prevention messaging and so forth out in our community, and also to develop those resources of what mental health opportunities are available. Again, going back to the data we collected in the needs assessment, it identified that people felt that was really a weakness in our community, but it may very well be that a lot of people don't know where those resources are. And so this was a great way that we compiled information and so forth for QPR, and then, or excuse me, for the residents. And then finally, I'll just say that partnerships have been amazing. Just being able to access who to know as an agency, as a local health department. We don't do mental health services and we don't provide those in our county, but certainly knowing where to refer patients and to get them the help that they need.
So Cathy, we need to thank our friends at Vanderbilt Health for that grant that
Yeah.
you helped Franklin Tomorrow secure in conjunction with Find Hope Franklin to provide that QPR training.
Mm-hmm.
And as the mayor mentioned, we have trained 11 people in the QPR to be QPR trainers. And then now they will start some of them are starting already, and in June working with school groups, with other groups to provide the training. But if someone wants to learn more about QPR or schedule that for their group, they can call Franklin Tomorrow's office or send me an email, mindy@franklintomorrow.org, and we'll put together those trainers who have agreed to go out and be part of our community in providing this training. So we're excited about that. Mayor, we were very excited that in this first group, we had the training officer for the Franklin Police Department, a training officer for the Franklin Fire Department, and how will that be rolled out in those departments?
Well, thanks for mentioning two of our staff that took that training, one from fire department, one from the police department. And I'm glad to say that they left that trainer program with great excitement, plan on taking that back to each one of their departments and training. So that's going to give us, roughly close to 300 people that could be trained in addition to the 75 or 100 that we've already trained in gatekeepers. So I hope this can become a contagious thing where people are eager to learn. Substance use disorder, mental health disorders, it touches every family. Nobody's immune from it. So everybody needs to understand better mental health and be more aware.
So identifying resources and building this Blue Ribbon Task Force that's now Find Hope Franklin, one of the things that came out of the task force was the need for greater coordination about response and understanding how we as a community can respond. And I think that's where you drew in James from Rolling Hills, right?
James has been a great resource, and I've really enjoyed working with him, and I've enjoyed how much he's offered himself up to be part of the panel and the resources that he has it's just like people in Franklin are great givers to the community, and James is fitting right in and fitting in that mold to give back to the community. And we certainly appreciate him and his expertise.
James, that's pretty high praise. And so we'd love to hear a little bit more about Rolling Hills Hospital and how you are involved in this network of care that exists and the network of response when someone is experiencing a mental health crisis or in need of assistance.
Absolutely, absolutely. Thank you, Mindy. Thank you, Mayor. Thank you, Cathy. Thank you, Patrick. I appreciate the opportunity to be here and talk to the group. I will say I was probably one of the people that wasn't completely surprised by the statistics that Cathy presented, which were great. The last number that I saw had that I think 9 million Americans were currently suffering from co-occurring mental health and substance use disorders. And then when you look at the number of Americans who are suffering just from substance use disorder, it's something like 20 million. So it's a staggering number in the country, and certainly as wonderful as we are here in Franklin, we're not immune to that. The fact that we've been dealing with COVID and are now hopefully towards the back end of COVID, that has certainly had an impact. The isolation that we've seen COVID create in the community is absolutely driving up the number of people who need mental health services. I think the last number that I saw from the CDC said that the self-reported rates for mental health issues was nearly double what it was before the pandemic. That's certainly what we're experiencing here at Rolling Hills. So we've seen roughly a 20 to 25% increase in the number of people in our community who are seeking services either on an inpatient level or an outpatient level. And I think that is directly tied to COVID and directly tied to the isolation that COVID has created. And so the need in our community has never been greater. So that's why I'm so proud to be a part of the Blue Ribbon panel that the mayor put together, because I think it is timely and I think it is absolutely needed. As far as the services that Rolling Hills provides, we're an inpatient psychiatric hospital and we offer outpatient services as well. But that's not really what I wanted to talk about on the call today. We've got a lot of our other sister facilities and competitor facilities in the market that provide services which are invaluable. What I wanted to really talk about briefly was the fact that everybody can be a part of this solution. I think studies show that roughly 50% of Americans have a barrier to helping people who are in mental health crisis or dealing with substance use disorder. And the reality is every single person can be involved in the solution. It's not just about the mental health providers. It's not just about the hospitals. It's not just about the community counseling centers. It is about everyone. And lucky for us, the National Action Alliance for Suicide Prevention has put out some very easy steps that anybody can do, 5 easy steps that are going to help you deal with someone who's in crisis, someone who's suicidal, or someone who's thinking about harming themselves. And the first thing that you can do is you can ask them how they're doing. I can't tell you over the course of 20 years how many times, how many people who have attempted suicide that I've come in contact with who have said, if somebody would have just come to me and asked how I was doing, asked if they could help me, asked how I felt, asked if I was having suicidal thoughts or thoughts of harming myself, that would have stopped me from attempting to commit suicide. I was listening to a gentleman at a conference just a couple of weeks ago, and I've seen him give this speech several times. He's a suicide survivor. He attempted a suicide attempt in New York City by jumping off one of the bridges there. And he said that he was on the bridge for 2.5 hours. And he said, I kept saying to myself, if somebody, this was a very busy bridge, there was a lot of traffic. He said, if one person will stop and ask me how I'm feeling or ask me how I'm doing, I won't jump. And for 2.5 hours, nobody asked him. And so he jumped. And luckily he survived and he's able to tell his story today, but it just goes to show you the importance of connecting with people, even a complete stranger. If they had approached him, he would not have jumped. And so, asking people, can I help you? How are you doing today? That's step number one, is just ask. Step number two is, how do you keep people safe when they answer your question? So somebody says that they're feeling suicidal, or they've got thoughts of suicide. What can you do? One of the things that you can do is you can connect them with the National Suicide Prevention Lifeline. You can connect them with Find Hope Franklin, where there's tons of resources available. You can talk to them about what their specific plan for suicide is. And if they have a specific plan, you can talk to them about how you could remove lethal means from their home or from the area in which they live. So that's the second thing you can do, is you can keep them safe. You can take them to a psychiatric hospital. You can take them to Williamson Medical Center. There's a lot of different things that you can do to keep people safe. And then the third thing that you can do for them is you can be there for them. Okay. And that doesn't necessarily mean being physically there for them, but it can mean being a lifeline to them, literally a lifeline over the telephone to them when they're having suicidal thoughts and they need to connect with someone. But whatever level of commitment of being there that you commit to, you've got to make sure that you follow through with it and that you're there for them when they need you. The fourth thing that you can do, and this is why I'm really proud of what the mayor's doing here in Franklin, is you can help them connect. So it's not just about the connection that they have with you, but it's about the connection that they have with the mental health community. So are they seeing a mental health professional? Do they have access to the extensive amount of resources and services that are available in the community? Helping them connect is exactly what Find Hope Franklin is all about, and it's why I'm so proud to be a part of it. And then lastly, the fifth thing that you can do is you can follow up. Once you've provided this safety net for the person that you're working with, once you've supported them to the extent that you can, you want to make sure that you follow up with them. You want to make sure that they're continuing to seek treatment. You want to make sure that you're continuing to ask them if there's anything that you can do to help them with their mental illness. You want to continue to follow up. And so those are just 5 easy things that any non-clinician, any person can do to deal with someone who is suicidal or trying to deal with mental health issues. And it just should never be a barrier, because anybody can do it.
That's just great information, James, and thank you so much. It's just great information. We are seeing people in crisis and situations occurring with interaction. With the first thought for many people is to call 911. Is that the first and best step, and what happens from there? Because I think a lot of people may not take that step because they don't know what happens from when 911 is called.
Yeah, so that's a great question. I mean, that's certainly an appropriate step to take depending on what level of crisis someone's dealing with. As far as what happens, I mean, the police department's going to show up, EMS may show up, they're going to assess the situation, and then based on what's going on the scene, they're going to make a determination about where that potential patient needs to go. And then typically what happens is, if the patient obviously needs medical help, they will take that patient to the emergency room. The patient will be assessed. If they're identified to have co-occurring psychiatric issues, they'll typically be referred to a psychiatric hospital like Rolling Hills, or any number of other psychiatric facilities in the area. There's also another option that the mayor alluded to earlier, which we're actually piloting at Rolling Hills, involving the Williamson County Sheriff's Department. In fact, we had several interactions over the weekend, where the Sheriff's Department can bring patients directly to Rolling Hills for treatment. One of the issues that we identified in Find Hope Franklin is that we have psychiatric consumers who are spending enormous amounts of time in the emergency room. That's really not good for anybody involved. It's not good for the patient. It's not good for the emergency room, because we're tying up a bed with a patient that doesn't really need to be in the emergency room. And so the thought was, we will have Sheriff's Department's deputies be able to bring patients directly to Rolling Hills who are not obviously involved in a medical crisis. thereby getting them in front of a mental health professional that much quicker. So I think 911 is a totally appropriate resource for people to utilize. However, I think we've got to give our law enforcement officers in the community at large a better set of options with where to bring people so that, again, we can get them in front of the clinical professionals as quickly as possible.
That's just great information. I know, Mayor Moore, that you have a desire to see a facility created in our community that can really help when there is a mental health crisis. And it would assist, I guess, in Rolling Hills and Williamson Medical Center and the other facilities, correct?
Well, I think James has made a good point that there needed to be some type of a facility that offered that continuum of care, such as he started this relationship with the sheriff's department. You know, the emergency room is usually stacked up with really sick medical problems, heart attacks and trauma injuries and so on. And those folks in the emergency room are generally, their expertise, I would think, is probably much better around those issues than mental health issues, at least from the information I've obtained. And unfortunately, many times patients would stay there 2 or 3 days. And James' involvement, we're going to see improvement in that. And long term, I think we'll be exploring what other communities have done and see what best practices might be implemented here as we work with our partners.
And I would encourage people to visit findhopefranklin.com to learn more about the information that's available there and acquaint themselves with resources, right, Mayor?
Absolutely. I appreciate your pulling that up. There's some great resources there. One of those resources just allows somebody that thinks that they may be having some type of mental health issue. There's self-diagnostic tests that gets them to a referral pattern. There are talk lines where you talk to real people. And I love what James said is that, you know, just say, how are you doing? I mean, just a simple question. And I like to say that we are a community that cares a lot. And just simply asking, how are you doing today? Just be prepared for the answer, though.
Be prepared for the answer, that's for sure. So any thoughts from our final thoughts from our panelists or comments about what's next for Find Hope Franklin and what's next for Cathy? I know the community health needs assessment is probably coming back around, right?
It is, yes, ma'am. We're already starting to prepare for that survey to be implemented next year. The other thing I think I wanted to add when we talk about partnerships or resources is certainly, and Mayor alluded to this as well, among our first responders, those paramedics, those police officers and so forth, there is that mental health first aid for public safety. And so I know that a lot of our public safety officials are engaged in that resource that, you know, either they take training annually, and I think it really helps them to identify, you know, or assist them in some of the events that occur, you know, that they're privy to out there in the community, unfortunately, and has been a valuable resource for them. So I just wanted to mention that one.
Well, you've been on the front lines for the past over a year of the COVID response here in Williamson County, and you've done such a great job, and we can't thank you enough, and all the people that you worked with, the team. But I know that you were also part of the COVID question line and the crisis line. So people were calling with real concerns, right, as well during COVID and that response?
Yes. Most of the questions obviously were around testing, vaccinations, and so forth. But yes, and I can tell you that our frontline employees, you know, they've not had the opportunity, the work from home opportunity, and they've been they've been on that front line since March of last year. And certainly, I think the Tennessee Department of Health did a really, really great job at providing resources for our employees to ways to deal with stress, and definitely opened up our employee assistance program for our employees as well. So it has been extremely trying. We hope we're over the hump right now.
And you hope you're back to the work of the health department, which is some more day-to-day operations, right?
Yes, ma'am. Yes, ma'am.
Well, thank all of you for the three of you for being here. Mayor, I know that you have, we've got James, thank you so much. And I look forward to continuing to work with you. I know, Mayor, you have an event coming up. Let me share our screen and let's talk a little bit about that. That event that you have coming up. Tell us about your next event.
Well, we're going to be making lemonade out of lemons. Our first date to have the State of the City for 2021 was canceled because of bad weather. And so we're going to do this on the 19th. We're going to do this at Franklin Park, which is an amphitheater in the business complex at McEwen and I-65. It's going to be a fun event. We've got some good entertainment there. You'll be able to learn how to make lemonade out of lemons and how the city has done it during this pandemic, and how we survived all the challenges of the past year.
Does it seem a little appropriate that the first one got rained out? It was just, more lemons, or was that the start of lemonade in our community?
Well, you got to have water to make lemonade.
That's a good point. That's a good point. Here is the sign up for people who would like to attend in person. That's at 11 a.m. on May 19th. Put the sign up in the chat and we'll follow up with that. But Franklin, tomorrow we have several things coming up and we are excited. Our new podcast edition will be coming up on this Thursday. And we've got our front porch conversation with Matt Largent. And so we get to know a little bit more about the man behind the economic development aspect. So we had a great conversation with him outside his office at McEwen Northside, and that was great. So you can find that on our website or our YouTube channel coming up on Thursday, starting on Thursday morning. Patrick's already done one, right? Patrick, you were the first front porch conversation.
I was a guinea pig.
You were the guinea pig. That's a really good way of putting it. You were the guinea pig, but we are excited to have that program coming up this Thursday, and then you can register for the mayor's State of the City on the 19th. Don't forget to take the survey, and we'll send out that information, the Survey Monkey, to complete the Civic Index survey. Or don't forget, there is one more in-person or one more virtual conversation on May 12th. And then this Thursday at 6 p.m. is the new City Hall Design Input Meeting. And that is a virtual meeting as well, I believe, Mayor. And people can find information on the city website, franklintn.gov, correct?
Absolutely. And somewhere there's a video circulating of why we need a new city hall.
That is a good one. We'll be sure and post that. It didn't rain on you, did it? Recently.
Fortunately, here in the lingerie department where I'm located, I haven't had any leaks, but there are many areas that have some pretty significant leaks in City Hall.
Oh, it's true. Well, there's lots of ways to be involved, and we hope that people will go out and follow those up. And I know our panelists are open to being contacted and have any questions or ways you can get involved. But don't forget, if you would like for your community group or neighborhood association to have the QPR training, just call us at Franklin Tomorrow or email me, mindy@franklintomorrow.org, and we'll put together a program for you. And it is totally free of charge. Thank you to Vanderbilt Health for the grant. And then thank you to the Tennessee Suicide Prevention Network for helping us be able to provide this valuable training through Find Hope Franklin for free. and that's a great thing. It's a great resource, and it's a great way to be partners in our community. Patrick, any final words?
No, this is a great Frank Talks, and thank you all for participating, and for everyone online and all over the internet that are watching. We appreciate everyone engaging with Franklin Tomorrow in all the different ways you can. We are ready to get back and in person, and we're hoping for the second part of the year to have more in-person events as things unfold here in Williamson County. So we'll be waiting for the guidance from our Cathy and from Mayor and others, but I think everyone is ready to get back to more normal. So thank you.
Any final thoughts from our panel? Okay, great, and good to see you all. Thanks so much, and stay safe and go out and make it a great day. And also refer this program to your friends. It'll be on Franklin Tomorrow's YouTube channel as well as on our social media, but refer this to your friends and watch it. But thanks so much, and go out and make it a great day. All right, we are not live streaming, so I don't think I'm gonna, thank you.